Yeah, I met Christine 30 years, it's almost 30 years ago, Christine. We were at Wellman, and she was there before that. She was a fixture there, which is good. So, yeah, we've seen a lot of things. I'm just going to present some cases. This is a case where one of the Mohs surgeons had, and plastic surgeons in collaboration had done a lentigo maligna case on the left lower lip. And the woman initially had trouble speaking. She was crying. And we did a series of pulse dye laser treatments and ablative and non-ablative laser treatments, and a year and a half later, she's much better. Some of this would have been tincture time, but it just shows if you are involved with a patient. We saw her frequently, like every 4 to 6 weeks. It kept her very engaged, and she now talks very normally, which is good. You know, CREST syndrome, and Kristen Kelly and I have had this discussion. When I see CREST patients, they seem like they're going to be so easy, but their vessels are remarkably resistant to treatment. So I did pulse dye with Purpuric settings, KTP with and without Purpuric settings, IPL, and I got her chest completely cleared. Her chest, she had multiple lesions in her hands, but these facial ones, I've been seeing her for 3 years, and I've done everything. She doesn't like the Purpur anymore, so I quit the Purpur because it wasn't working any better anyway. So I just keep going at it, and they keep getting a little better. But I think there's something about the morphology of these vessels, and Kristen's going to look into that. Maybe it makes these more resistant to treatment because they look so easy. They look like this is like, you know, fishing in a barrel, but it's not so easy. It's like her chest. I got her chest completely clear. It's just odd that the chest responded so much better than the other lesions. This is a remarkable case. In fact, I just saw this gentleman back yesterday. He had radiation therapy. He's a poor guy from England originally. He has lots of squamous damage. He's had everything Mohs, and he just came in with all this almost exuberant granulation tissue, almost erosive pustulosis. We did PDT on him back in November with Ameluz gel, and about 2 weeks later, he cleared up. Now, I just saw him back 2 weeks ago because some of it had come back, so he might have to go back to Mohs or radiation again, but he's been radiated so many times. But a remarkable improvement after one session of PDT. Here's an interesting guy. This was a gentleman who had, at the Navy we saw, he had a 5-year history of this facial rash. It was coming back and going, coming and going. And I just saw this gentleman back about a couple weeks ago as well. This is May of 21. It turned out it was eosinophilia angiolymphoid hyperplasia. And we did a couple of test spots. We did an Alex test spot, and we did a test spot with pulse dye. It's pretty dark. That was one of the problems. So this was the biopsy, angiolymphoid hyperplasia with eosinophilia. You can see the biopsy there. This is the biopsy again. And what we did is we did pulse dye. Very challenging. We had to use a lot of dynamic cooling, fairly low settings. But the treatment, we've been treating him. He had all these things before, doxy, all the things that you would see in LaBalle's book or anything else have been used for this condition, which can be very challenging to treat. But we said, let's try the Genomax. So we actually did the Genomax, and we used settings 40 joules, 8 millimeters, 60-30 spray. Kind of aggressive for him just because he's so dark. And we were able to kind of get him cleared up, you know, pretty well. It's not perfect, but it's kind of all we had that worked because we tried everything else. And we just saw him back, I think, about a month ago, and we did a little touch-up treatment because some of it was coming back. This is a very challenging case. If anybody has any ideas about this case, let me know. This guy, I just saw him a week ago. I've been seeing him for a year. Young man, he's 15 years old. He has this kind of acquired, almost port wine stain-like lesion. The mother says it's been there for a while. I did a biopsy on it because I kept treating it, and my friend Deb Atkin also treated with pulse dye laser, and the vessels go pretty deep. This is down the sebaceous glands, and the vessels are a little large, and they're deep. There was no sebaceous hyperplasia or acne. We had been on doxycycline, and I've used 755, 595, 532, various pulse durations, and this is the biopsy. You can see how deep these vessels are. Some of them are really deep down here, probably 3 millimeters down. And he does have sebaceous glands, but there's not sebaceous hyperplasia. So I've got him here. I just saw him again 2 weeks ago. I'm putting on sirolimus. We got the Hyptor gel to help, but I'm just very, very frustrated with this guy. He doesn't care as much as his mom does. His mom cares a lot about it. He kind of goes, okay, Dr. Ross, treat me again. But if anybody has any other ideas, I've just tried everything with this guy, and I don't want to scar him. That's the thing. I was even scared to do the biopsy. It was a 2 millimeter punch. Fortunately, it healed remarkably well. We've been combining eczema with vitiligo with Opzelura. That seems to be working, which is kind of a neat little trick. We use the Opzelura and the eczema laser. Self-harm scars, we've been trying all kinds of things. More recently, we're using the 2910 fractional laser in the micro mode, and we're getting better. Here's a woman who is kind of fresh off. She saw some red scars. We did that pulse dye, and we included non-ablative fractional, and more recently we've done ablative fractional in 2910. It's not perfect, but she is getting better. I got this case referred to me by the oculoplastic surgeon. It's this older man, he's 87, he has all this diffuse actinic damage on his upper eyelid. And at first I was like, why are you sending me this patient? I thought, you know what? There's really not a lot of good options here. You can't use PDT here, it'd be really hard to do. You could, but the gel might get in the eye. Efudex is really a poor choice because it's getting in the eye. And I said, you know what, this is a good case for CO2. I just did standard conventional CO2, put an eye shield in, and this is him 3 months later. He was very happy. So I think there's some cases where there's really not a lot of good options other than laser because it's just the way it is. Acanthosis nigricans, we see a lot of this. And Alan Rosenbach, who's not here, I don't think, but he wrote a really good article using the long pulse Alex. And I tried to replicate what he did. He was using the Elite laser, 20 joules per centimeter squared, 10 millimeter spot, very mild Zimmer, 1 or 2 in 5 milliseconds. And this is a patient before, and this is her after. It's not perfect because I left some spots behind, but it does work. It does work, but it's kind of painful. I've tried everything else for acanthosis nigricans, including all the paralytics. It's a very challenging condition to treat, but you might try this technique. It was written up. Here's her pre-test spot. I do a test spot for cases like this and think it's helpful. Here's my last case, and if anybody, this is a poor guy. He's a BU student, actually, but he comes back to San Diego a lot, and he developed this about a year ago, and he saw some of the local dermatologists, was placed on doxycycline, dapsone, isotretinoin. I did a biopsy. It turned out it was granuloma faciale. I've only seen him for about 2 months, so I saw him fresh and said, I'm going to try everything I would normally do and see if I can get him to get better. So I've done intralesional steroids, I've done Alex laser and pulse dye laser, and to be honest, after 2 treatments, he's not a whole lot better. Some people have suggested biologics. That might be my next move. I've talked to some of the pediatric dermatologists as well. So if anybody has any great ideas, that'd be good, because he's my last patient and my toughest patient, and I'm willing to entertain anything to help this poor guy. I really feel badly for him. Thank you.
Thanks, Vic.